May we turn to item 4 on the agenda, which is the patient voice, and I'd like to invite Tim Kelsey to introduce the paper. Tim.
Thank you. Thanks, Malcolm. Well, just to also pass on, I hope, the thanks of the board to the team that did organise Expo, as you kindly did at the beginning, and in particular Ronan O'Connor, who is our regional director in the South, who just did a fantastic job. And plans are already in place for looking forward to next year. For me, I mean, in a way echoing, I think, what David said, this was a demonstration of a new kind of conversation between health professionals, health service professionals, patients, carers, citizens at large. The community was kind of represented. For me, it was the beginning of a very important milestone on our journey towards a genuinely, an NHS that genuinely takes participation seriously. So just on Expo. But there were two sort of big themes that came out of Expo that are also represented in the paper, and I was just going to briefly touch on those. First of which is NHS Choices, in the sense the digital future, that we want to give patients control, and Choices, which is the online information channel for the NHS, and located at the URL www.nhs.uk. Started in 2007. I had actually the privilege of designing it at that point, and today now has more than 40 million visits per month. In fact, it's beginning to record single days on which it's getting over 1.5 million unique users. It's become in itself a kind of a social movement, I think. And the vast majority of those people are English. They are ordinary people who are, I think, obviously seeking more information about health services, looking at data on comparing different sorts of services and so on and so forth. And what we have very ambitious plans to expand the opportunity for engaging with information for people taking more control by extending, as the paper describes, what is currently an online portal to mobile phones. We already provide some service over mobile phones. We're going to be expanding that very significantly, and also, of course, in a way stimulating, I hope, an apps revolution, a place where entrepreneurs of all kinds of shades, whether social entrepreneurs or in business, are able to sort of bring their innovation to patients, and so Choices is a platform really for those people to bring great things to people. One thing I'd point to in relation to the Choices plan, and I'll come back with much more detail on this over time, is the way in which it will be pioneering the promotion of awareness around people's ability to access their records online. We'll come to care.data a bit later on, but there's a very, very important need for the NHS to give patients the data about themselves, give people back their own data, and we've committed to providing people with online record access from 2015 in GP practice, in general practice, where they wish it, and Choices will be a very, very important route for people to get access to that kind of service, alongside other related services, things like being able to book an appointment with your GP online, being able to order an online prescription, and quite apart from just convenience, these are initiatives which will, we think, very much help people who have, say, a chronic condition be able to self-care better, and also a means by which the NHS can in a way move the power from the internal world to the world of the patient and the citizen. So that's just one highlight which is in the document. The second area, which again was very much showcased at Expo, and indeed launched at Expo, which I'm going to hand over to Victor just to say a few words about, was NHS Citizen, which just is a fantastic initiative to enable people, communities across the country to hold this board properly to account for promoting its values, for delivering real outcomes for patients. So, Victor, I don't know if you wanted to say something about...
Well, thanks, Tim. We did launch. We took NHS Citizens out for a spin on Monday and Tuesday, and I thought it was fantastic. We had over 100 people come to the assembly. We had a conversation between myself and Kieran and Tim and others and members of the public, and a number of things came out of it. First of all, it forced us to speak English and not NHS, which is really helpful. And we had, but it was a conversation that revolved around what matters to people in real time, in real life, and that was actually quite helpful. So there were strong suggestions about how we communicate that touched on things like care data, which I know we're going to talk about, and we had a real sense of an audience, an involvement, a co-production of something with patient citizens, which was incredibly powerful going forward. I know other people might want to comment. I think it was I thought it was just great, and we've been designing this over a year, and it's been a bit tight-ropey because there isn't a chair, there isn't a committee, it's different, the intention is different, so the process is different, and the outcome was different, it felt different. So the involvement of the Tavistock and Demstock and Include, that were external organisations that held us to account for the intention of the process, was incredibly powerful. And I don't know whether Kieran wants to say a bit more about what he felt about it, but I'd like to see the NHS citizen be driven into the culture of NHS England, because my concern would be that we are going to grow this thing. It is going to happen, but there has to be a credible response internally, which is about the culture of the NHS shifting, which it will do. So I'd like it to drive what happens next in terms of how we do the AGM. It's no longer a Victor, Kieran, Tim project, it is a board project, so I'd really like to invite board members to get involved with the assemblies and to discover the joys of speaking to our citizens who pay for it all.
No, I can only agree. I thought it was a fabulous conversation for a number of reasons. One is it was listening, not talking at, and just hearing what real people's experience about access to communication, understanding what it's like to be somebody with learning difficulties, to go up and ask a receptionist to explain something and be told, I can't do that, I haven't been trained to do it, where the human bit is, here's what it means. So I think that being grounded in reality is important, but the insight was truly deep as well. So this isn't a kind of a skim across the surface thing. It's up to us now to take things away and change things because of that. And I think we're going to be talking about care.data in a short while, I'm sure, but kind of links into that, the approach to hearing what people's concerns around privacy, around sharing, hearing what people see as the benefits of doing this, and doing that through this kind of approach, I think is important as well, in addition to the deep thinking that we do sitting around a table sometimes. So I think this has legs. I think it was a great example of what David was talking about. One of the reasons there was a buzz in Expo was this kind of thing going on and it being authentic and real. First time out the gate it was great. Let's make it better the next time.
And in that context, I just quickly wanted to show a short film before we get on to care.data, if that's all right, Chairman. It's which captures some voices. We've been doing a lot of work with people looking at not just care.data, but the whole technology, digital, ambition, and trying to listen to people about how best we can shape that, not just communicate it, but actually shape it to their advantage. So we've had various events, and these are just some voices from one of the events which we had recently. So as we just put the film on, if that's all right. So I'm chair of this thing called the ISCG, which is shortly to change its name to the National Information Board. More of that in the meeting this afternoon. But the purpose of it is really important, although the acronym is really difficult to get. And the purpose of it is basically that for the first time, everybody in health and care, all the organisations in health and care that are delivering services of one sort or another, have come together as a whole group to try and figure out how we best make the most of data and technology in health and care services. And that's been a really important collaboration. We've been at it for about a year. We've made some amazing progress, I think, in thinking through the challenges, some of the opportunities we've got. And later this year, we'll be publishing a strategy which will be the beginning of thinking really differently about how we can put data technology, transparency, participation, how we can start making kind of patients in control real, much more real in our services.
Everybody in this room has their own answers, and you're part of discovering what some of those answers might be for you in your space. And it's very much about hearing citizens, patients, service users, people who use the NHS and social care, getting your views heard in the world of the Informatics Services Commissioning Group.
What I would like to gain from today is that patients have access to their own data.
Okay.
Patients have access to their health records, and patients know who's looking at their health records, where it's going. I mean, I'm not against my data being used for the benefit of other people, not at all. However, I think there needs to be a bit of reciprocal care taken. You can have my data, but I'd like it too.
Patients need, and others need, to be able to use the system, and that in terms of control of the data and access to the data, that control needs to be personalised. So again, picking up the previous thread about what do I want to share and what do I think I don't want to share, that control should be in the hands of the patient.
Again, quite consistently, about the need for national standards and guiding principles, which may sound very obvious, but I think what was more powerful about that was that it really does require strong leadership.
The words safe and secure were used, and that the criticality of data quality, so that what was actually entered into systems was consistently high quality.
The inequalities of people's accessibility to digital inclusion, to ensure that there isn't a group of people that become invisible due to their inability to, for whatever reason, access data, digital data.
Our penultimate point was there was a huge amount of energy in the room, and that people fundamentally felt that the prize was worth going for, and that if we take people with us, we've got a much higher chance of achieving that prize.
We need a right to review. This isn't a one-off exercise, and I think the majority of people in the room believe that. So let's not walk away from here or wheel away from here and believe that the work is done. This is just the beginning of a very long journey.
Thank you. And that actually happened a few months ago, but just gives you a flavour of the kind of thing that's actually going on as we develop our approach to these very complex issues. So if I may, just to move on to care.data and just to give the board an update of that programme. So the board will remember and indeed approved the issuing of directions to the Information Centre some months ago for the extraction of data from general practice, so that we can link that, or they can link it, to hospital data. For basically the best part of 25 years, the NHS has been taking and anonymising data from hospitals, individual person-level data from hospitals, and using that to really important effect. I mean, it was a very important part of how we got to identify some of the very difficult, poor quality care that was being provided in Mid-Staffordshire, for example. So things like more death rates are calculated using the hospital data. We have no equivalent data in out of hospital care, and as a result, we are not able to be proactive and accurate in the transformation of services in the way that we need to be. And fundamentally, without this kind of data, we can't possibly make real our ambition to have an outcomes-based health service. It will be not possible for us to properly target services at reducing variation in quality without this kind of data. So it is fundamental, not only to NHS England's own mission, but to the future of the health service. Hence, we issued those directions. A couple of weeks, or 2 or 3 weeks ago, however, there were some very wise voices from all sorts of parts of the health and care community, from the GP representative bodies through to Healthwatch and others, who were getting increasingly concerned by the lack of apparent lack of safeguards around handling of this very sensitive data, about the way in which the NHS could properly underwrite or underline its commitment to privacy. There were voices that were concerned in the voluntary sector about the degree to which the programme had properly explained itself accessibly to all communities. I think that was a very important point that was raised there, and so on. And so I took the decision, obviously in consultation with colleagues around the board, that we should delay the extraction for 6 months. We had intended to begin the Information Centre was going to begin the extraction from general practice in in March, but we took the decision to push that back to the autumn. There were essentially four areas of concern. The first of those, as I've said, was around really clear, transparent assurance of both the safeguards with which very confidential private data is being handled in the health service, and real clarity around an assurance of the uses to which that data would be put by different users. So that was one thing that came out very strongly. A second thing that we've been asked to address, I think quite rightly, is in an unprecedented way, actually, for the first time, we've decided collectively, NHS England and the Department of Health, to give people the right to opt out of this programme. This data is the patient's data, and it's absolutely right that patients should have the right to make a decision about whether they want to participate in care.data. So we've given them this new right, and that, because it's a new thing, hasn't been explained terribly well, I don't think, in retrospect. And what we need to do now is to be much clearer about what that means, be clear that, in fact, when you opt out of care.data, it does mean that no clinical data leaves the GP practice. Just be absolutely clear about that, so that people are aware of what the mechanic is. And I think also there's been a concern in general practice that it wasn't easy enough for people to opt out. So we need to look again at that. There was a lot of concern about the quality of the public information campaign that surrounded care.data. That particularly came from voluntary organisations and Healthwatch and so on. And I think there were some very important points that were made there. I'm not saying, in fact, that the team didn't do, as it were, all the right things. They did do the right level of consultation in launching it, but actually all the normal ways of doing things aren't good enough anymore. And so we must accept that we're learning, and what we learnt was that the public information around care.data just wasn't good enough. But I think there are lots of things, and it's been really great that so many people have now stepped forward and said, look, let us help you organise this so it really does reach out properly. Hundreds of voluntary organisations, and just to quickly say thank you for everyone sort of coming forward with offers of support. So the third area of concern was public information. And the fourth, to be honest, and we're working now really closely with the BMA and the RCGP and just GPs in general, was supporting GPs much more closely with information and resources to make sure that they are in a position to properly provide information to their patients about their rights and about the risks and benefits of care.data. In the light of that extension, a number of things have already happened. So one of the, an important observation is that the government is very, very supportive of this programme, absolutely believes with us this is a fundamental requirement for a modern, intelligent health service. So it has already moved to table legislation. And there will be an amendment to the Care Bill, which is already on the parliamentary record, which will do a number of very important things to improve the safeguarding of this data. So it will, for example, provide a statutory basis now for applications from people to have access to it. A body independent of the Information Centre and NHS England will be responsible for making those decisions or advising on who should have access. It will also create a legislative basis for the opt-out. So what was before an informal opt-out now becomes a legal right, which I think is a very important move forward. It'll also prescribe uses of the data to just health benefit. So certainly we want people who are supporting health and care services, whether commissioners or providers, to be able to work with this data in a way that's sensible, so private businesses or voluntary organisations supporting the analysis of this kind of data for health benefit. We absolutely want that to happen. We absolutely want the research sector, life science sector, to be able to use this data for very important purposes in terms of driving the frontiers of science. But what we do need to be clear about is this data is not going to be used for purposes that are not related to health service improvement or patient benefit. So again, the legislation very clearly does that for the first time. So I think despite the issues we've had with care.data, I think the importance now is that we have, I think, an unprecedented opportunity to put data sharing in healthcare, maybe as an example for more broadly for the public service in general, on a properly solid, grounded footing, which, to be honest, when we look back, hasn't been the case in the past. So this was a conversation that should have happened a long, long time ago. It's happening on our watch, I think, in a way, although it's tough, It's also a privilege. And I think at the end of this, if we work closely enough and collaboratively enough, which we are committed to doing with partners in the voluntary sector, partners in the professional community, and across the civil society at large, we can put data onto the kind of footing that it needs to have for the NHS to be a sustainable, high-quality service in the future. So just a couple of other very small points. Alongside the legislative kind of proposals, there is a whole bunch of work going on which we're coordinating to try and address some of the other issues that have been raised. I mentioned some of them, but in particular also to work on the public information and awareness, particularly around the opt-out, shaping that in a way that's really accessible. And I've asked Kieran if he will chair a kind of an oversight advisory group for the programme board of Care.Data, which is not just NHS England. I've taken on the role of SRO for Care.Data myself to demonstrate that that it is my responsibility working collaboratively with everybody else. But that advisory group will have a number of voices on it, key stakeholders, the BMA, the RCGP, Healthwatch, and so on. So that's just to say that there are, amongst other initiatives, that's one that we can describe now. But the next few weeks are weeks in which we are listening to all our partners to understand what the substantive issues are in more detail, what we can do better in relation to ensuring that patients are properly aware of their rights, the public at large, and so on. So I'll be coming back to the board with an update on progress on a regular basis. I'm very happy to take any questions now.
Well, Tim, thank you for that update, and particularly for the reassurance. I think the board remain totally committed to the outcome of this project, without which I think the NHS is flying blind. We have remarkable amounts of data, but very little intelligence that we can yet glean from them. What we, I think, as a board, are keen to ensure is that we have real assurance about what happens in the 6 months, how it's to be organised, and how we, as members of the board, can participate in this process to try to ensure that the criteria that you've outlined this morning and the steps you've outlined this morning are taken, clearly communicated. And I would particularly, I think at this stage, like to commend both the BMA and the Royal College of General Practitioners for the clinical support that they've given us, and look forward to being able to work with them through the next phase to try to ensure that we are absolutely clear about the benefits that accrue ultimately to patients from this, while safeguarding the opt-out rights in the way you've described. I'm going to invite colleagues then to raise any questions with you. Kieran.
Happy to do that, I think, Tim. But it's good. We're going to need to make sure it feels much more like an NHS citizen than a bunch of us sitting around a table having deep thoughts. So, and I think you and I need to do a bit of work on that.
Other comments? Bruce and Margaret. Bruce.
Thank you. Chair, may I just say a couple of words? I think from a medical perspective, I think the majority of senior doctors in this country to varying degrees would think that we have a professional duty to do two things in this. One is to pursue the agenda that Tim describes, and the second is to absolutely ensure that the citizens of this country can be clear and reassured about both the quality and the safety and security of the data. And the reason for wanting to pursue this, I think, is that it will bring huge benefits. You use the term the NHS flying blind, and I think that's quite a good description. This will be uncomfortable when we start it, because it will expose some difficult truths, some areas of variation that we don't understand, but which we can only resolve if we have the right data to understand it. It'll help us to understand where we can better place our resources, and it'll help us to understand the natural history of diseases and what interventions that we can put in place that will influence those diseases for the betterment of patients. So I think this is something that we have to do, but the security and safety are absolutely crucial.
Thank you, Bruce. Margaret.
Coming from a retail background, I have to say that I'm really very, very keen that we do manage to harness and exploit data so that people recognise that it's to their benefit, because the retail sector already does this hugely. I mean, everybody willingly gives huge amounts of information to Tesco, Amazon and so on, so that their own specific brand of needs can be catered for. And this is so much more important than shopping. So I'm really incredibly keen that we establish what people recognise as a trusted method of harnessing and using data to the public benefit and to the benefit of all our individual and collective health. In doing that, I think it would be useful if we could make sure that the legislation actually builds in a review process, so that if people have opted out, we can then go back to them and say, sometime later on, do you now feel more comfortable in opting in? That's the first point, is making sure the legislation actually allows for that. The second point is it's reliance on a trusted brand, and I think one of the things that's going to be critical here is getting GPs whom people trust on side. And I was actually quite disquieted by the numbers of reports of GPs saying, we're worried about the safety issues around this. So what we need to do, obviously, is to get into a position in which we can give assurance to them that the methods are safe, that the outcome is being used in a way that they feel they can robustly support.
Victor?
I think that this came up at the NHS Citizens discussion, and I thought what was really powerful, nobody was saying it was a bad idea. Not one person. These were just members of the public. They all kind of got it. And I thought that the conversation was really powerful in that they were saying, actually, NHS England, we got it wrong, and we need to learn. And that was the start of the learning, because you were there, Tim, and you were great in just accepting what they were saying. I think it is about working with the consumers of this information. They have to see the vision. It's not about making somebody a few bob, or it's actually about them, and we might have missed that message a bit. So I really welcome the approach that's now been taken. I think the use of NHS Citizens to really make it a co-produced communication as well as a product is really powerful, because people should be going along to their GPs and asking, and getting a reasonable response. I also like the idea of some sort of annual report back to the public about how this has been used and who's been asking for it. It'd be really powerful too.
Perhaps just on that point, I should say that yesterday the Information Centre, which is the body which processes all this data, has said that it's going to, first of all, has appointed one of its non-executive directors, Nick Partridge, to review the history of ways in which this data has been made available to people, and that will all be published when he's finished his review, which will be quite quick. Plus also that in the future there'll be total transparency around who is using the data and for what purpose. So I think these are very important additional kind of assurances that from now on there'll be total clarity around who and what gets access to this kind of data.
Can I just make one other tiny point? One of the other points that was made at the NHS Citizens thing, which I think is very powerful, is that we need to really focus the design of our communications on those people least likely to either get the message or use the service. Because if we do that, they will help the rest of us get a really good service. So there's an argument for starting with the people with learning disabilities, people from minority ethnic groups, because actually, that if we can do it for those people, we can really. So I'd be really interested in, as this process goes forward, to see evidence as to how those groups are receiving the message and how we're building it with them.
Just a point about context. I think the lady, Tim, you had on the video who was saying, I'd quite like to see my own data too. There's still a bit of, well, those people, they can look at your data, anonymised, of course, but, they get access, the great and the good get access, but actually I'd quite like some access myself too. And I think that almost for me, one of the critical bits of this is what you were talking about, access to patient records from April next year. That's important, because that begins to help people say, well, actually, now I know a bit more about what they're talking about.
Tim, thank you very much for that, and thank you for leading on care.data. I think you get a sense around the table that it has the continued strong support of all the directors. I'd like particularly to thank Kieran and Victor for the role that they will be playing. And I think the linkage through with the Citizens' Assembly is immensely powerful.
Sorry, Chairman, forgive me.
I'm sorry, Margaret, yes, please.
Citizens' Assembly, I didn't have an opportunity just to make one small point, and that is that I'm hoping that the Citizens' Assembly has a forum for young people and children to come through and speak.
Yes.
Thank you.
Right.
Sorry.
I think it's potentially a very powerful mechanism, and the process over the next 6 months of engaging with all stakeholders, including all of those that we hadn't thought of earlier but are coming through these different mechanisms, will be fantastic. Okay, so Tim, thank you very much for that. Is there anything else from your report?